Today, let's talk about the early signs of autism spectrum disorder. Right. Now, before we jump into any of this, keep in mind that depending on your family history as well as your pregnancy journey with your child, some of these things might be expected. So your best friend during this time is your child's pediatrician. They'll let you know what's expected versus what's an actual delay. Okay. Now, so one of the first signs that most parents see is developmental delays, especially around language. So many children begin to speak somewhere between around 9 months and 15 months. That range, you start hearing some babbling, and then you get some words and you get some phrases. So if your child is not giving you anything or they're not progressing along those lines by like 18 months, talk to your pediatrician. It could be an area of concern. Next one here is little to no interest in social interactions, right? Many kids, when they see other kids playing, there is this inherent wanting to join them. So if your child consistently couldn't care less when other kids are around, it's something to keep in mind as well. And then there's unusual social interaction or play pattern, right? So the few times when they actually want to engage with another kid, instead of actually going on and playing with them, what they'll do is almost like grab the other child, almost like come with me in a way that feels forced and obviously not appropriate. That could be one way. And then the unusual play patterns would be typically that they play with toys or objects in a way that most kids do not play with them that way. It makes you go, why are they doing that? And lastly, and this one is typically more common in autism than any other neurodevelopmental area. It's regression. Regression is when they have achieved the skills, such as language, they gather words, they're good for several months, a year maybe, and then out of nowhere, they lose them, right? Or they're potty trained, they're good, and then before you know it, now you need to put diapers back on them on a daily basis. Yeah. So that level of regression is often seen in children with autism and not as much in maybe children with ADHD or other neurodevelopmental issues, right? Of course, there are a whole lot more. And for those, consult your pediatrician. Peace.